First of all, thank you very much for taking the time out to do this. We like to start out with is just highlighting the change in this year's survey. We are splitting out the two different types of surveys. One is for sheltered and one is for unsheltered. And we, meaning the Montana Continuum of Care, will be coordinating the shelter count this year from Bozeman. So we're taking that part of the survey off the shoulders of local PIT coordinators so they can focus more on the unsheltered or the street count. So the Montana Continuum of Care from Bozeman will be coordinating the sheltered facilities, coordinating the housing inventory. We will be sending out the surveys and the confidential agreements to everyone, and we are providing training opportunities. Because we're splitting those out this year, there might be some issues that we just want to put on everybody's radar. But the first one is we're still asking coordinators to help us identify the shelters. There's a new emphasis on street counts. So if coordinators are not as comfortable with doing canvassing, we're more than happy to help with that. We just want to make sure people are aware of there will be some overlap between emergency shelters and the street count. Shelters have street outreach programs and street outreach workers, and they're very important parts of the street count, but they also do their own facility count. So there's just going to be some overlap. Some communities have collected all of the surveys and did their own tally before sending them in to us because they won't have access to those sheltered counts or surveys. That won't be as possible this year, but if that's an issue for any community, we'll figure something out. We do ask everybody, facility contacts as well as the PIT coordinators, to take a look at the 2018 protocol. That's just a more formal document. It does have more information than what's in the training today, such as how you can access the mini grants that support local survey efforts. We will be providing webinar trainings for the volunteers, the interviewers. We do have a new YouTube training video, and that link has been sent out. So I just want to emphasize up front the importance of training. We know both from HUD research as well as other nonprofit research that the amount of training has a direct correlation and a direct impact on the data quality. And we do get checked by HUD on the amount of training we do. If you do any training on your own, we just ask that you make note of it and just send us an email. Let us know so we can document that and let us know how many people were a part of your training. Okay, a little bit on the housing inventory. So the process for doing it is different this year. We have sent out the housing inventory from 2017 to all the coordinators and to all of the facility contacts. So the inventory data technically is supposed to be what your inventory was on the night of January 25th. We will ask you to confirm those numbers right after the survey. So I don't know if it's obvious or not, but so we're comparing inventory to the number of people using them that night. This all goes into a data bank at HUD, and when the number of beds utilized and the number of people surveyed do not equal, we just have to explain that to HUD. And a typical explanation is a person simply did not want to participate, which is fine. But if there's another reason, we just need to be able to explain that. So what goes into the inventory? Emergency shelters, both domestic violence shelters as well as other emergency shelters, but also any programs that provide a voucher to a motel. We really rely on the point-in-time coordinators to help us identify those. But if you're aware of any, let us know. Transitional housing programs for the homeless and permanent supportive housing programs. Those permanent supportive housing numbers come directly out of HMIS or from the Veterans Administration. I wanted to just kind of go over the criteria for what goes into the inventory because we do still get a call or two every year about why isn't my program in your inventory? And here's the reason. There are basically two definitions. The simplest one is we only put in beds and units that are dedicated to serving homeless persons. The other definition is we only use projects with dedicated beds and a project where the primary intent is to serve homeless persons, but also where the program verifies the homeless status of that person as part of its eligibility or intake. So turning to the survey itself now, so we do like to just remind everybody why we do this. We do it in the middle of the winter because it is a part of a nationwide survey that's taking place simultaneously. It is the basis for a report to Congress. It is a grant requirement, so in order for the Montana Continuum Care Coalition to remain competitive for what is now $2.4 million in grants, we have to not only conduct a survey, but do it in a way that comports with the national protocols. But the survey does go a long way in building public awareness around homelessness, and both state agencies as well as local governments use that data in planning, and a lot of nonprofits use it in their grant writing. So we do have three main goals that we have to really focus on. Coverage, we need to count as many as possible. Consistency, we have to implement the survey the same way in Miles City as we implement it in Missoula, but also nationally. So a large degree, it has to be consistent with the way Boston implements their survey and the way Bozeman conducts their survey. And then over time, year to year, so that the data is trackable. And then accuracy, and we adopt best practices that come down through the HUD guides every year to make sure we're doing it as accurately as possible. In order to reach those three goals, we have some elements: statewide coordination, volunteer recruitment, site identification and coverage. That's both of all the facilities in the state that go in the housing inventory, as well as the local PIT coordinators coming up with all of the outside or canvassing sites. And training, that's a key element. Let's look a little bit at the unsheltered count for a minute. In some communities, the local PIT coordinator is not the same as the local COC coordinator. And we just want to make sure that the PIT coordinators know that they can go to the local COCs for assistance if they need. The other important part, and this does kind of relate to facility counts too, is hopefully you have a plan that was documented somewhat last year that has contact information, sites identified, and you can pull that up out of a file from last year and not have to start all over again from the beginning this year. It's important to update those sites, to recruit committees if necessary. We are emphasizing youth again this year in some survey efforts. Go to the schools, they go to their school homeless liaison, and they might put a focus group together of the homeless students trying to find out where they think you can best find homeless kids or the best way to survey homeless kids. And in other communities, the high schools have LGBT clubs, and they can be a big help. But whether the local PIT coordinator puts together committees or not, it is important to recruit volunteers, cover all those sites, and to come up with a plan that includes, assigning those interviewers to different locations, or arranging a briefing on the night of the survey perhaps, coordinating transportation maybe, but then most of all providing training. So those unsheltered sites typically are any place that's not meant to be slept in. On the streets, in an abandoned building, under a bridge, in a camp, a park, a vehicle, which includes a camper and a bus station or anywhere else. The unsheltered count includes service site counts. Those are meant to capture any unsheltered person who was missed on the night of the survey. If we have surveys at these sites over the following week, it's another opportunity to capture those that were missed on the night of. This year we're going to do a little something different to take note of the number of surveys that are coming back from these service sites. Because the question has been raised that it might not be worth the effort. We're not really getting that many or any surveys from service sites. So we want to review that this year. And we'll review that and decide. But just FYI, so those typical service sites are Project Homeless Connects. Those events are considered part of the service-based sites. But food banks, thrift stores, healthcare for the homeless clinics, libraries. Now, planning a shelter count. So we are going to coordinate those, but it's important that every facility identify a coordinator, a specific person to oversee the survey in your facility on that night. It's important to have a bit of a plan. It's not extensive, but just when are you going to do the survey in the facility? Is it right after you close the doors that night and everybody has to be in the facility, or before anybody exits the next morning? Just to have that planned, and what the process for interviewing residents. In bigger emergency shelters, it can get pretty chaotic, so it's important to have a definite process in place, whether you're just going to hand out the surveys or have somebody carry the surveys around and do the interview. Recruit those interviewers, whether they're staff or volunteers from outside. Make sure they go through a little bit of training and make sure they know when they're supposed to do it. It's really important to have somebody, hopefully the coordinator, on site when the interviews are taking place so they can kind of watch over the interviews, and if there are any questions or if somebody's looking kind of confused, that they can help the person fill it out or answer any questions. And then again, that person, that coordinator, is going to be asked to fill out the cover sheets and verify the data. The survey this year is on the night of Thursday, January 25th. We are going to continue emphasizing youth again this year. Last year was the baseline year across the nation for coming up with a youth count. And we are going to use, again for the second time, confidentiality agreements. And if you weren't a part of it last year, just remind people, the confidentiality agreement just asks for three things: that clients agree to keep the information confidential, that is, any surveys that have been filled out, that all surveys will be protected and kept out of the public view, and that the interviewer or anybody else involved won't knowingly enter any inaccurate information into the surveys. So it's pretty straightforward and simple. You don't need to send those agreements into the Montana Continuum of Care. If you don't, we ask that you just hold on to them for about 6 months or so, just in case we have any issues that arise. But if you do want to send them to us, that's fine. We'll keep them on file. So a little bit about the timing again, what we mean by the night of the 25th. At least 80% of the whole survey effort will occur between sunset on the 25th and sunrise on the 26th. The other amount will occur at those service sites. Definitely no survey should be taken before January 25th, and I would even say that no survey should be taken before at least late afternoon on the 25th, if not, in the evening. And a little bit more about that. So this is a graphic that comes right out of the HUD guide. When people say that the survey is on the 25th, it actually is on the night of the 25th and the morning of the next day. And what that really means in practical purposes is, for the unsheltered or the street counts, they probably shouldn't start until shelters have closed their doors for the night. That they should complete them before sunrise the next morning. In Montana, my personal advice is that we complete those before midnight, and that's just more out of safety. But again, that's a local decision. So if you have a time by which residents have to be in for the night, you would not want to start the surveying process until after that. Going back a little bit more to interviewers, so who fills out the survey? We allow an interviewer. In fact, that's the best. We prefer that. We allow a homeless person to fill it out, him or herself. That works best if there's somebody in the immediate vicinity to lend assistance if they need it, to make sure the survey gets collected too. And that we do allow case managers to fill out a survey on behalf of a client when it's necessary, when they know that their client won't be accessible, available, or for some reason won't participate. That's really important. We stress trying to get interviewers whenever possible, because we know that the response rate is higher and the accuracy of the answers is higher when an interviewer is conducting the survey. But we want to emphasize that the interviewer still needs some training and needs some practice. So we've been tracking, we would love to get all of the surveys across the state conducted by interviewers to 80%. Who makes the best interviewers? Current homeless people, formerly homeless, but also residents of your own programs can be with a little bit of training, maybe the best interviewers available. You can use any volunteers that you want. Just make sure they get some training. And that YouTube video is excellent. That video does emphasize, though, that's critically important to at least practice that survey with a dry run or two. We know, again, from data and experience that the more the interviewer understands the questions and what the response options are, they'll be more comfortable in the interview process, and that comfort level transfers to the person being interviewed, and that person is much more likely to trust the interviewer and to give more accurate responses. So we really emphasize that. Might just point out up front that it's important to be patient. It's at least a 10-minute interview. All right, so just some of the basic do's and don'ts on the actual survey questionnaire. Don't use a felt tip marker because they bleed through and our scanner can't read them. Any kind of a pen or a pencil is best. Survey the head of a household or the head of the family. The reason for that is questions about whether they're a veteran, what kind of income they receive. That's the kind of question that the head of the household can answer best. Just fill in an oval, don't use checks or X's. And then there are some frequently asked questions that really help to address right up front every year. The biggest one is, why do we do a survey in the middle of the winter? Like I said before, it's done nationally at the same time. Do people need to answer all of the questions? No, they don't, but we do need to ask them all. Some questions are too personal. Yes, we acknowledge that. And again, they can pass on any question they want. And we need to define homeless so people know who to survey. There are different definitions of homelessness. Both our survey questionnaire and our data processing accommodates those different definitions. What we tell people is, no, you don't need to know who meets different definitions. Go ahead and survey anyone who you think is homeless, or survey anyone who thinks that they are homeless. And then back to the ask. It's critically important that we inform everybody up front that all the answers are confidential, anonymous, and voluntary. That they only answer the questions that they want. They just say pass to skip a question. And this is very important, that we communicate to them that by passing, it will in no way result in denial or otherwise affecting the services they might receive. A few highlights that I need to walk through. So the front page of the survey is called the facility identification. There's some other information there. There are some instructions, but the facility identification box is only for the sheltered surveys. So if you are involved in a street count or unsheltered survey, just ignore that completely. The where slept question is critically important. Even though you might be surveying somebody out on the street, we do need to ask if they are sleeping on the street that night, because there are occasionally individuals who will be congregating with their friends who are homeless, but they do have a couch to sleep on that night, or they might even have an ESG or rapid rehousing bed. So we just need to confirm that whether or not they are sleeping outside. So we need to ask that question. In a sheltered facility, it's probably more apparent and obvious. So whether it's just a facility coordinator verifying that they were in the shelter that night, or an interviewer just verifying it. And for service site locations, it's just important for the PIT coordinators to make sure that somebody at the service site who's overseeing distributing or handing out those surveys, that we are asking them to tell us where they slept on the night of the 25th, since the survey site locations are occurring after the night of the survey. It helps to understand that there are a couple of pairings on where you slept that night. So with friends or family, it could be voluntary or not voluntary and intended for a short duration, as opposed to a voluntary for a longer duration. So we need to distinguish between those two situations. For a motel or a hotel, it's also important to distinguish between two options. They could be in a motel that night with a voucher. In other words, an organization is paying for it, as opposed to staying in a motel that night that they're paying for themselves. And then in an apartment or a house, they might be in an apartment that's subsidized or paying for it themselves otherwise, and that's just another option we need to collect. Chronic homelessness is one of the most important things we need to determine in a survey, and we do it in 4 questions. Question number 7 asks, how long have you been homeless? We can give them the options and the respondent can just simply choose one. Question number 8 asks, how many times have you been homeless in the past 3 years? And again, that might just be a guess. Give them the options. And number 9 can be a little harder to answer. It says, altogether, how many days have you been homeless in the past 3 years? And the options are less than 12 months or more than 12 months. Might be helpful just to emphasize this is just your best guess. We don't want to frustrate any respondent. So just make it as easy as possible by asking, do you think it was more or less than 12 months? The other very important part is in the demographics or the self box. This is where we ask them, do you have any of the following disabilities? And if they do, we need to ask if any of those disabilities keep them from holding down a job or living in stable housing. And that's simply a yes or no. If they have indicated they have a disability, it's vitally important that we ask that other question. We are supposed to make sure that enumerators or interviewers understand what the definition of disability is and that they make sure that the respondent knows that answers are voluntary. So this is where you might want to repeat those items I mentioned before, that all questions are voluntary. They simply say pass if they want to not answer one, and that not responding to any question will not result in a denial of service. Definition of a disability, this is the simplest one that we can use to communicate to interviewers. Really just 3 components. 1, it's an impairment, and it could be physical, mental, or emotional. It could be caused by alcohol or drug abuse, post-traumatic stress disorder, brain injury. It's any kind of an impairment, mental or physical. And then the key characteristics are that it's of long, continuing, or indefinite duration. In other words, it's not just something that they're going to be over with in a week or 2. And that it substantially impedes a person's ability to live independently on their own. Okay, identifier information. We have to be able to deduplicate surveys. It doesn't happen very often, but it does. And it's a part of the required protocol from HUD. We do this by comparing a couple of pieces of information and collecting the first name of the person. So if they say Pistol Pete, we really don't want a nickname. We want their real full name. So it might be Pete or Peter. The initial of their last name, so if it's Smith, it's just S. And the day of the birth, so if it's December 16th, it's just the number 16. And that's really a critical part of the survey. In the demographics table, I just want to point out a couple of things. Question number 16 asks, including yourself, how many adults and children are in your household? So they mark down the number of adults and they insert the number of children, and that includes themselves. So if a respondent has 2 accompanying, let's say, children, this should add up to 3, 1 adult and 2 children. And then also, this should equal the number of self-respondents, but also the number of accompanying persons who are identified on the back page. So on the back page, there are 5 columns, 1 for each accompanying person. And so obviously, 2 of those columns would be filled out for each of the 2 children. Columns include information about age, gender, ethnicity, race, and disability. If for any reason the respondent is starting to get antsy and an interviewer can tell that they're losing that person's cooperation, or if they just turn around and walk away or don't want to answer any more questions, we do allow an interviewer to guess at a couple of things: their age, their gender, and their ethnicity. It's better to have a guess than no information at all. But we want to emphasize only if it's the only way of getting that information. And on race, I might just clarify that. So a person should mark all of the different races that are applicable, and that gets reported as multiple in the HUD report. Oh, one other little thing we do like to emphasize is, so sometimes a person will say that they do have 1 or 2 children, especially in a shelter, but even in a street count. If an interviewer doesn't see any children in the immediate vicinity with that person, they should probably just follow up and clarify So are these children living with you? Are they sleeping with you tonight? Because sometimes people will include children that are back home with a spouse or a partner, and they are not with them. Just a little bit about what a household is. Most cases, it's a family, a nuclear family related by blood, but not always. There can be extended families. There can be partners, either married or not. But the idea is it's just more than people who are traveling together. And if there are just 2 or 3 adults and they consider themselves friends and they're camping out at a camp together, they should be interviewed separately. A few things to point out on gender. This has changed again for the 3rd year in a row. That 4th option has been changed to gender nonconforming. That is not exclusively male or female. That is hard to ask that one, but it's very important that interviewers be very sensitive to gender. So just offer those 4 options to a person. Okay, well, with that, the last slide is simply contact information. Anybody can call on the 25th, and we will have a hotline number, so anybody can call with questions, and we'll post all this information. But the most important thing I can tell you is thank you so much for agreeing to help with the survey, but also going through this training, because we do have to document that we do provide training, and it gets scored in the COC application, which now provides grants to 18 grants over $2.4 million. So we need to safeguard and remain competitive, and doing a good survey is a part of